I will be talking about a review of resources provided to bereaved individuals in an Australian healthcare setting. A bit of background about bereavement resources. So resources make up an important part of bereavement care, and bereavement standards in Australia, the UK and Ireland all include information provision as a key aspect of universal care provided to all bereaved. So we reviewed 30 resources that are currently provided to bereaved individuals by staff and volunteers within the Nepean Blue Mountains Local Health District in New South Wales. You can see some examples of the types of resources on the screen. We reviewed understandability and actionability using the Patient Education Materials Assessment Tool, readability using the Sydney Health Literacy Lab Editor and the Flesch-Kincaid grade level, relevancy to Aboriginal and Torres Strait Islander people using the 7-item checklist developed by Diaz et al. In 2023 and applied by 2 Aboriginal members of the research team, and accessibility for culturally and linguistically diverse populations by assessing the availability of resources in languages other than English and the cultural inclusivity of information and resources. We found that the majority of resources were not understandable or actionable. They required a high level of literacy, on average 3 grades above the recommended grade 8 reading level that is suitable for the general population. They were not relevant to Aboriginal and Torres Strait Islander people and were only minimally inclusive for CALD populations. So what does this mean? From a health service perspective, both for Nepean Blue Mountains Local Health District and for other health services in New South Wales and Australia, this really highlights the importance of ongoing maintenance and quality review of resources. One way of doing this and also increasing accessibility is to have a web repository of resources available on the health service website. You can see 2 examples on the screen from Western Sydney Local Health District and Illawarra Shoalhaven Local Health District, both in New South Wales. More broadly, these findings really recommend that government agencies and community organisations consider usability, literacy, relevancy to Aboriginal and Torres Strait Islander people, and CALD inclusivity when developing resources. So some steps towards this could include using tools like the PMAT and readability calculators when developing resources. So these tools are user-friendly, easily accessible, and not hugely time-consuming to implement. And we also recommend engaging in a co-design or consultative process with Aboriginal and Torres Strait Islander people and CALD populations when developing resources to really make sure that they are inclusive and relevant. And that brings me to the next steps of this project, which is to partner with Nepean Blue Mountains Local Health District to engage in a co-design process to develop more inclusive and relevant resources. And that is an acknowledgement of the research team that worked on this